Moving forward for the next presentation, I would like to call upon the stage Dr. Rekha Gupta ma'am. Dr. Rekha Gupta ma'am is a certified diabetes educator and pediatric nutritionist who has conducted numerous workshops on nutrition awareness across schools and healthcare platforms. Welcome ma'am.
Good afternoon, everyone. I'm Dr. Rekha Gupta, and I'll be talking about nutrients imported in CKM syndrome, and basically more on magnesium and potassium. Cardiovascular disease, chronic kidney disease, and metabolic disorders were once treated as separate conditions. Today we recognize the interconnected components of a single continuum called cardiovascular kidney metabolic syndrome, which this conference is taking place. So while pharmacological therapy plays an important role, emerging evidence suggests that micronutrients such as magnesium and potassium significantly influence insulin resistance, vascular health, and kidney function. CKM syndrome describes the interaction of cardiovascular disease, kidney disease, metabolic disorders, which includes obesity, diabetes, hypertension, dyslipidemia, chronic kidney disease. Nutritional deficiencies significantly influence disease progression. That's what we are going to look at. So this is a normal interconnected continuum which says that if one is affected, the other is also affected, and they have a shared pathway: inflammation, insulin resistance, oxidative stress, inflammation, and RAS activation and electrolyte imbalance. So integration, heart, kidney, metabolism. Micronutrients influence all three organs by reducing oxidative stress, inflammation, and metabolic dysregulation. So pathophysiology is generally insulin resistance, then there is a chronic inflammation, oxidative stress, endothelial dysfunction, altered mineral metabolism, mitochondrial dysfunction, and hormonal dysregulation. Then this is a vicious cycle of cardiovascular kidney metabolic syndrome. It shows heart disease, kidney disease, and metabolic disorders continuously worsen each other through several biological way. So this vicious cycle, we all know, it starts with metabolic dysfunction, which gives us a lot of fatty acid, insulin resistance. That leads to dyslipidemia, which can cause inflammation and affect the kidney disease. In same way, it will affect cardiovascular dysfunction. There will be oxidative stress, and it will affect kidney. So this is a vicious circle which happens. So the diagram represents this oxidative stress, which causes damage to blood vessels, endothelial blood vessels, endothelial dysfunction, and increased inflammation. Oxidative stress accelerates both heart disease and kidney damage. And we know when there is a metabolic dysfunction, it will include obesity, diabetes, fatty liver, and dyslipidemia, which will affect the heart. Metabolic dysfunction leads to increased blood pressure, increased lipids, increased fat disposition. These worsen both heart disease and kidney disease. We know insulin resistance can lead to type 2 diabetes, hypertension, and obesity, and it has to be seen. CKD contributes to CKM, increased blood pressure, causing electrolyte imbalance, increasing toxins, and CKD therefore worsens heart disease and metabolic dysfunction. Same way in cardiac, if we don't have a proper cardiovascular function and we go into CKM, then there will be hypertension, atherosclerosis, heart failure, poor cardiac function, which reduces kidney perfusion and worsening CKD. So the problem statement is, despite their importance, micronutrient deficiency, especially magnesium and potassium, are common in patients with metabolic syndrome. Metabolic syndrome, diabetes, hypertension, and CKD patients. These raises an important clinical question. Can optimizing micronutrients slow the progression of CKM syndrome? Studies show that magnesium deficiency is associated with higher risk of diabetes, cardiovascular disease, and chronic kidney disease. So if we do early intervention with nutrition therapy and see the micronutrients, we can do and see if the magnesium and potassium are balanced, then we can reverse this CKM or CKD process. Role of micronutrients. Micronutrients regulate metabolic pathways, maintain vascular and renal health, reduce oxidative stress, improve insulin signaling, support mitochondrial function, and deficiencies can worsen CKM progression. So the micronutrients which are very important are magnesium, potassium, vitamin D, B12, zinc, and selenium. And if we have shortage of them, then they can lead to dyslipidemia, which will lead to type 2 diabetes, which can lead to dyslipidemia, then inflammation, and of course hypertension, oxidative stress. These will all lead to cardiovascular disease, chronic disease, and dyslipidemia. Micronutrients act as key modulators that influence the heart kidney metabolic axis and may help slow progression of CKM syndrome. So we will be talking about magnesium and potassium, how they influence several parts in this cycle, including insulin resistance, blood pressure regulation, inflammation, and vascular function. Therefore, optimizing micronutrient status may help interrupt the CKM progression. So magnesium and potassium are not just electrolytes, they regulate enzymatic reaction, blood pressure, glucose metabolism, and vascular tone, key pathways involved in CKM progression. Magnesium acts as a cofactor for more than 300 enzymatic reaction involved in glucose metabolism and protein synthesis. Potassium plays a crucial role in maintaining cellular osmolarity, nerve transmission, and cardiac function. So this is the cycle of magnesium. Magnesium generally starts with altered metabolism, which leads to insulin resistance and diabetes, which will of course damage the kidney. And the kidneys, when they are damaged, they will lose more of magnesium. And once they lose more of magnesium, it will affect the heart and it will cause arrhythmias and hypertension. And if we have low magnesium, it will be also not good for heart health. So basically, magnesium is very, very important for having a good outcome of all the organs and not leading us to a CKM syndrome. So if we have enough magnesium, the required amount of magnesium in our body, then the outcome can be reduced vascular calcification, we will have a better CV health, it will also reduce the insulin resistance and also reduce diabetes risk, which will not create CKD and heart problem. So it improves insulin sensitivity, regulates pressure. Deficiency can be linked to syndrome and metabolic syndrome and diabetes. And this is a study done by Barbagallo and Domino goes. Same goes with potassium. Potassium, as you all know, is very, very important for both heart, kidney, and metabolic health. So generally, when the kidneys are affected, the potassium becomes high because the kidney is not able to excrete the potassium. The more of hyperkalemia we have, what will happen? We'll have arrhythmias and blood pressure, and it can also lead to, if it is very high, it can lead to cardiac arrest. So once the kidneys are affected, then the heart health is also at risk. Heart health is also at risk when the metabolism is more, fatty acids are more, sugar is more, and you have diabetes, it will affect kidney and heart health both. So this become a vicious cycle. So what happens is that we have to see that potassium is very in control. CKD patients generally have high potassium levels, more than 5. Then it has to be taken care of. Otherwise, they can lead to cardiac arrest, arrhythmias, hypertension, and it can be very, very dangerous for life. So potassium plays a central role in cardiometabolic excess. Both hypokalemia and hyperkalemia significantly affect cardiovascular outcomes. Low potassium is associated with hypertension and arrhythmias, while impaired kidney function in CKD reduces potassium excretion, increasing the risk of hyperkalemia and cardiac complications. Additionally, potassium imbalance influence insulin secretion and glucose metabolism, linking it to diabetes risk. Therefore, maintaining an optimum potassium balance is critical in management of CKM syndrome. I will tell you some more micronutrients which are very, very essential for CKM syndrome. One is vitamin D. What it does is it modulates immune function, reduces inflammation, improves endothelial function, which is associated with CKD progression. This is study done by Pills et al. So basically vitamin D generally we see is very less in diabetic and kidney patients and total CKM patients, so it should be treated so to reduce the effect. Then vitamin B12 and folate are also very important. They reduce homocysteine levels, support neurological and vascular health. Important in patient taking metformin, because generally the patient who take metformin, the B12 levels decrease. Then there is iron, which is very essential for oxygen transport. CKD patients are generally anemic. They develop anemia. Iron deficiency worsens fatigue and cardiac function. This study was done by Wells and Goodnow, that they told that oxygen is also very, very important. Then there is zinc, which supports immune function, improves glucose metabolism, important antioxidant. Then we have selenium, which is a powerful antioxidant, protects against oxidative stress, important for thyroid and metabolic functions. The dietary sources of magnesium are nuts, seeds, pumpkin seeds, whole grains. Vitamin D, we all know that it is generally sunlight, but sunlight we generally don't get. We have the most abundant sunlight in India, but 90 to 99% of the people are deficient in vitamin D. That can be due to many reasons. So you should have sunlight, fortified foods, and if it is very less, then go in for supplementation. B12, dietary, dairy, fortified foods, iron, legumes, spinach, and many other things, and zinc, pumpkin seeds, whole grains, selenium, nuts, and cereals. Assess micronutrient status in CKM patients, correct deficiency early, integrate dietary therapy with pharmacological treatment, and personalized nutrition can improve the outcomes. So conclusion, CKM syndrome requires integrated management. Micronutrients play a critical role in metabolic, renal, and cardiovascular health. Nutritional intervention can be reduce disease progression. Thank you.
Thank you, ma'am, for the wonderful session. In favor of time, we'll have only one question from the audience, if any, please. Okay, sure, we'll take the questions online. Thank you, ma'am.